Welcome. I'd like to introduce my new surgical practice. It's called Rise Surgical. And one of the things I'd like to talk to you about today is the advantage of robotic hernia repair. I'm specifically talking about incisional hernias. For those of you that have had prior surgery where your abdomens had to be opened, say hysterectomy or a colon surgery, we all know we can get hernias there. And there's a lot of different ways to fix those type of hernias. The traditional way is you make a big incision through the prior scar, a lot of tissue is exposed, and then you suture a mesh in to repair that defect. That tends to have the longest stay and the longest recovery, and honestly it's the highest risk for wound problems and recurrent hernia. Many of us can do laparoscopic hernia repairs too. This is where we're putting mesh inside the abdomen, but in order to secure that mesh, you have to use sutures that go all the way through the abdominal wall, plus a tacker, kind of like a nail gun, that tacks the mesh through the muscle. You can't really control the depth of how far those tacks go, and it can cause pain. In fact, one of the more painful surgeries that I do traditionally in the past has been laparoscopic hernia repairs. But with the advent of the robot, it's given me new technology and new techniques to be able to repair incisional hernias even better with shorter hospital stay, less complications, and better fixation. All these things get you back to work and back to doing the things you like to, like fishing, hunting, much sooner. Specifically, the arms on the robot are wristed. That means I can move them in all different directions. So when I'm looking inside, I can suture the muscle closed, which is a better repair to begin with, and I can put the patch of mesh up against that with a perimeter well outside of the defect. And then because the robot's so precise, it allows me to suture and pass a needle to hold that mesh in place but control the depth of how deep that needle and that suture go. Honestly, with the patients that I've been doing this on, they hardly have any pain after surgery. They go home the same day. It's a dramatic difference that I'd like to share with you. Thank you.